Hello explorers, I am Sushmita and I create review, travel and cooking videos on my channel. You know what to do. Press the subscribe button and don't forget to hit the bell icon so that you get notifications whenever I post something. Many of you know that recently in the month of January I delivered a baby. Yes, I had a planned C-section and my experience was incredible. I delivered my baby at my hometown, one of the best hospitals here. My hometown is in Gorakhpur in Uttar Pradesh. One of the best hospitals which I am talking about is none other than Bharti Hospital. And not just the best hospital, but the best doctor. Under the best doctor supervision, I delivered my baby girl. Can you guess who I am talking about? Yes, I am talking about none other than Dr. Sugandha Bharti, one of the best doctors we have in Gorakhpur. Today, I take this opportunity to thank her and to welcome her in my channel to answer all our queries, all our questions related to delivery, care and recovery. Welcome Dr. Bharti and thank you for giving us your time.
Thank you Sushmita for being with me. I'm also highly pleased meeting you after such a long time. After your childhood days, then your marriage, then your baby and now today. It's pleasant. Really, I'm so very happy to see you.
Before we start, I would like to ask you, please walk us through your day. We know that it's pretty hectic, but I want you to share your day schedule and your likes with us.
Yes, definitely a gynecologist and obstetrician's life is jam-packed with activities and activities. But I start my day with morning walk and yoga. It has been for last 20-25 years.
Wow.
I have been maintaining this schedule of mine. Then when I come home, then I really love doing cooking.
Wow. I remember the dishes we had. Yes,
I love cooking. So I like preparing some healthy breakfast every day.
Wow.
Then just after getting, and then my target is to reach hospital by 10:30, but it becomes 11. But fine. Then I sit till lunch, and then after a break of an hour, I again join the evening clinic till 7. And in the meantime, and even after 7 when emergencies
oh my god, yes,
we have to go. And then elective deliveries and
planning
operations.
Yes.
I plan in between my OPDs.
So it sounds so hectic. I have a lot of questions from the viewers also and from me, my side also, related to delivery, related to C-section and the delivery. So the care, what we should take, and the recovery, how we can recover fast. So I want to ask few questions related to that.
I would be very pleased to answer your queries.
So what care should we take post delivery, like a baby and the mother?
That rest, diet, exercise has to be taken care of. Post delivery care is very important because एक तरह से समझो कि फिर से रिजुविनेट होती है बॉडी
जी
बहुत सारे it is a normal physiology pregnancy but definitely the whole body undergoes stress. I am the patient as well. You must have experienced that pain and lots of fuss is there. Pre and post delivery fears as well. You must not call fuss. It was really a fear for a primary gravida like you.
I remember texting you before I entered the operation theatre. मुझे डर लग रहा है. And how sweetly you just calmed me down. Nothing to worry. Relax. Pray.
So, but then usually the whole family is with the patient. But many times only the patient and her husband.
Oh my God.
So there also you have to take care of the mother and the child as well. Though then for the mother, rest is also very important. There's a rule: 40 weeks of pregnancy and 40 days followed by 40 days of rest. At least 40 days of rest the patient must have. From time since long, it is a rule. All patients take rest for 1 to 1 about 40 days. You can say. In that rest, exercise is included, sleep is included, diet is included, which all has to be taken care of. Sleep becomes very much disturbed.
Oh my
because
God. Please
child never sleeps more than 2 hours at a stretch.
Yeah.
And the mother has to get up with the baby, but then she should take out time to fulfill her sleep as well. Otherwise, headache and weakness and all sorts of complaints come in between. Walk is the best exercise. Besides this, perineal exercises are a must post delivery to give your perineum your pre-pregnancy level, and then no urinary or bowel problem occurs if you take proper perineal exercises. Besides this, for the baby, you have to take care baby massage, baby bath, everything. Little things make difference.
Yeah.
That the water should not go in the throat or chest or eyes when you are giving the baby a bath. So you should be careful about it. When you are breastfeeding the baby, you must clean the breast with warm water. While you are feeding the baby, the head of the baby should be up. After every breastfeed, you must birth the baby so that there is no risk of inhalation if the baby vomits. And moreover, for the patient, feeding from both the breast is a must.
Okay.
Many times, patient is comfortable in one posture and she feeds only from one breast and realizes very late the size of the two breasts are different because one breast was active and one was not active.
Yeah, and that changed the entire
look of the patient.
Yeah.
And no one wants to look bad. Everyone wants to look beautiful.
Yes, totally.
So, and it is only with a little care that you can manage it.
Yeah.
Breast support is necessary. Extra expression of extra milk is necessary because engorgement of breast can lead to breast abscess or painful breast, tender breast, which may create problem for the mother.
Oh my God, okay. So this one was a very important tip for all the new moms out there like me, that we have to be very careful while breastfeeding as well, because that is one of the most important things that our child is intaking, as well as it's important for our body.
Yes, definitely. Breastfeeding is very important both for mother and the baby.
So I want to ask that what care can we take of the stitch, and what are the precautions like you suggest from your side?
See, initially we used to put single stitches.
Yeah.
Now with advancement, we now put subcuticular stitches. Now the sutures have evolved such that they dissolve on their own. So patient's hospital stay has been minimized.
Wow.
They can go home, the stitch will dissolve on its own, so they don't have to wait till the stitches to be cut and then discharge, which we used to do some 10 years ago.
Wow. So I think that means I have been
use that subcuticular dissolving stitches, but these stitches have a little less strength than the mattress sutures that were used previously. Okay. So we give binders for some time, that helps the patient, and then just not lifting, weight lifting, not more, you can only the weight of the baby is allowed to lift, and so that the healing is comfort. You heal in your comfort zone. There's no problem. And after a week, you just take a bath, clean your stitches, apply some ointment which has been prescribed to you, so that the stitch is moist and soft.
I'm going to paste the link of the ointment that you gave me, because Trust me, my mark of the operation is barely visible now. So all thanks to you, my body is back to normal. I just need to lose some weight, of course.
I'm so happy for you, Sushmita. And that I know you will do it.
So please tell me how, means like when should I start exercising, or when should I start doing something that I lose my weight again?
After 3 months of operation, you can start exercises, do it gradually. I think walking, you can do it right now also.
Okay.
Whenever you feel nice, you can start walking. First start in your home, then in your garden, and then you can even go to do walking in some place, some park, or wherever you get the facility for walking. And 3 months after, you can do the rest of the exercise.
Like normal Zumba or maybe weightlifting.
After 3 months, you can do anything.
Wow, so that's going to be great, and this is something new, because half of them were scaring me that no, I have to wait. But I was...
Yes, many patients ask that my auntie had a cesarean and her tummy has come out.
Yeah.
The tummy has come out because of eating. I'm not doing any exercise. Whether it be a normal delivery or a cesarean, you have to do workout, you have to take care of your diet to keep yourself beautiful.
So like you said, you do yoga, so I'm going to go for yoga as well.
Yoga is where it gives peace to your mind as well as freshness to your body.
Totally. I'm going to stick to yoga after this, because like saying you have not changed a bit. Like I remember when I was 6 or 7 years old, grade 1. I still remember you look the same. So I'm going to stick to yoga.
Should I get it as a compliment?
Yes, it is. I too want to look like you when I grow.
That's a real compliment.
So what are the medications you suggest that post-delivery should we take, or should we continue our folic acid? Like usually you prescribe folic acid and vitamins and calcium. So do you think like post-delivery should we continue that, or?
Some medications are required, but a good diet minimizes the role of medications post-delivery. You have to take a good diet which contains protein, vitamins, folic acid, calcium, which you can get from many fruits and legumes, cereals, dry fruits, etc. But then calcium is secreted in milk. Then the baby will take its part. So you should take care of yourself also. So calcium should be replenished. Vitamin A, if you take colored vegetables like carrots, tomatoes, most of its requirement is met. But still you sometimes need to take vitamin A, folic acid. Calories also must be increased, because in a daily breastfeeding mother, 500 to 700 calories extra is required for breastfeeding. And fluids should also be there, because lots of body fluid is used in making milk, as well as most of the body fluids which has been accumulated in the pregnancy goes out in the urine. So water intake or liquid intake should also be considered. Just a deviation from your routine medicine, I would like to say that family planning is very important.
Yes.
And that could be an oral contraceptive pill, which is low dose pill and does not affect the milk. Rest, you don't need any medicines.
Okay, so now I want to know, is there any complication that we are going to face, like being a cesarean or post delivery? Any complication that we face, and what can we do if it happens ever?
See, complications are rare. Nowadays, rare with all the medications, good anesthesia, good diet, healthcare. Complications are very minimum unless and until you are a high risk case.
Okay.
If you are not a high risk case, that is something else not to be discussed here. But you really don't meet any complications. Some patients do say that they have profuse bleeding. Then, of course, she should visit her doctor and take appropriate medicines. Patients complain that I have inadequate milk. That is sometimes her wrong assessment.
Okay.
But I think diet and the sucking of the baby it itself is a stimulation for milk letdown.
Yes.
And appropriate milk secretion. But some really have less milk, then we prescribe them some medicines for increasing milk. Otherwise, good diet and sucking of the baby itself is a medication. So then, and one more thing I would like to say, that many patients that I've come across, patients saying I have hair fall. Actually, it is the hair gain due to hormones in the pregnancy is a hair fall. So it is up to 5 to 6 months you have to go through it, and then it is normal. And because side by side the growth, new hair comes out, and it's nothing to worry much. Mood swings is another problem, and especially when you are who depends upon the nature of patient to patient, and mood swings can be dealt very easily with love and affection of the family. Rarely patients lead to depression. If so, they can meet a psychologist or a psychiatrist, but the love and affection of the family matters.
And I would mention here even the doctor, because you have been so supportive, like from the day one. You have been like a pillar. I would say, like being a doctor, like giving attention to each and every patient and being a pillar to them is like, means I can say that it's been a lot. It's so important for a patient as well, because we have no idea next abhi kya hone wala hai. So it's like, I remember like walking to the OT and I was oh my god, and seeing your face, you were like, relax. That made me so calm. That made me like, I was like, I knew that I'm in good hands. So I was really very happy with that.
Thank you so much, Sushmita.
I want to ask you, like, this is a little bit personal. How do you maintain the balance between work and family? Because I remember, like, when I was growing up with her daughter, like, she's my friend. So I remember you used to throw us those beautiful, wonderful parties, theme parties, where we enjoyed, and most of the memories are from there, so of childhood. So please tell me, how do you...
Arranging birthdays was a secret. I never celebrated it on the very day. I always did it on the following Sunday, so that I would have time enough. But I don't remember any party completing without an emergency landing in between. So, but then everyone was used to it. Used to it. And then my in-laws were also here, and my parents were also in the same city. So family help was also there.
And for us, the children side, if I tell you that those were the bestest ever.
Then it was best for me also. Enjoying with all of you, it was fun.
It sounds easy, but I am pretty sure it's very hectic for you, like maintaining both work and family, and like giving us all such beautiful memories. So thank you for that as well.
It was very nice being with you.
It is really nice to have you with us, you giving us your important time. I know like half the people are waiting out for you. Sugandha Bharti, the best doctor in Gorakhpur, I must tell you, the best gynecologist. Actually, she's the best in gynecologist ever you'll meet. So please do come and visit Bharti Hospital if you want a secure, safe, and you want the mother and the child to heal fast, to be mentally stable. Please come and meet her, and please share some love to this video. And if you have any other questions, please put it down in the comment below. I'll personally ask ma'am. She will take out time and we are going to answer it all. And I hope you liked it. I have also added the link of the previous video where I am reviewing Bharti Hospital and I'm sharing all the features, the good features it has. Please watch it. I hope you enjoyed talking to me today.
Very nice. I already said it was very nice being with you, Sushmita, after a long time.
Thank you so much.